Hello, hello, hello. This is the Ageless Traveler, and we have a very special show today because this is a show that really fulfills some of the promise of the Ageless Traveler to help you never stop traveling. So lately, I've been hearing some things that I don't like to hear, like I've traveled burnout, or I just don't have the vitality anymore. So, what we've discovered for healthy, mature travelers is that there are three reasons that they sometimes get logy. One is, above everything, hydration. We've talked about that on the show, losing your electrolytes. The other one is mobility. We do have some arthritis. We do have some of those issues, maybe a hip or a knee replacement. We're very bionic. So sometimes that becomes an issue. But there's a third one. And there's a third one that's rarely talked about, certainly not in the context of travel. And that's our hormones. Because we're older, we're rarely ever in the loop of talking about hormone replacement therapy. We've heard of it. We've heard of it, particularly if we deal with nutraceuticals or we're looking at longevity aspects of our life. But what is it? What can it do for us with regard to our vibrance? And can it actually help us do more things longer, like travel, like pursue hobbies, like even work? And of course, what do we need? We need an expert, and we've got one. And her name is Dr. Jeanette Gray, and she's with us to unpack this very, unusual issue. And that is we just don't feel like ourselves. So thank you, Dr. Gray, for being with us today.
My pleasure. Thank you for having me.
So I think that one of the threshold questions for a lot of folks is they've heard about hormone replacement therapy. They don't know what it is. They may not even know what a hormone is when it comes to our age group. Young people we know. I have a sister-in-law who was a math teacher in
Mm.
ninth grade, and people would ask her, "What do you do for a living?" And she would say, "I teach hormones to count."
Oh my
So
goodness.
we know about young people in this, but we don't know about older adults in this. So
Yeah.
what is hormones and hormone replacement therapy?
All right. Well, we all have hormones, whether it's at birth or the day we die. So we all have hormones. Let's just set that straight. Then we have times in our lives where hormones seem to be more impactful. Obviously, puberty.
Right.
And then when a woman is in her reproductive years. And then we have menopause and postmenopause, which really, frankly, is a good third or more of a woman's life. And it's a period in her life where hormones are not at the levels that they were. In fact, estrogen, progesterone, and testosterone go down significantly at menopause. And then especially testosterone continues to go down as we age. And a lot of women, when they get into that postmenopausal stage of life, used to think that, well, I guess, my life as a vital woman, is over. I'm in the last phase of my life. But, I'm here to say that that does not have to be the way we think, and that very much hormones can be implemented or used in that third stage of your life and can be very beneficial.
So let's take a look at that. You mentioned testosterone. We
Mhm.
have a series here on our travel show called Travel Bros, travel men who really love to get out there and travel. And we had to do it. And I want to tell you why, Dr. Gray.
Mhm.
Many, many women who travel solo, which is
Yeah.
a big thing now, are married. They are not single. And the reason they travel solo is their husbands don't want to travel anymore. And I ask them, I have the privilege of meeting so many of them, they're tired, these guys.
Yeah.
The women aren't. So when we talk about hormone and hormone replacement in a minute, I don't want people to think this is a women's show. I'm going to be
Right.
talking about both of this, and many times it's the companion that has the
Yes.
issue that stops you from traveling. It's not you,
Mhm.
right?
Right.
So, but we talked about estrogen, we talked about testosterone and others, and these are hormones. But what is
Yes.
hormone replacement therapy?
Yeah, well, it's a term that's used because we're saying, okay, your hormones are no longer at an optimal level for feeling your best, feeling the most vibrant you can, and frankly, living a better, longer life. So hormone replacement is a term used to say, okay, I'm going to put back the hormones that you now are deficient in. it's not necessarily the best term because I like to think about hormone optimization, where it doesn't have to be abnormally low, but it's not optimal for your sense of well-being.
So how do you know? I've never seen a lab that included my hormones, never one time.
No.
What's going
Well,
on here?
well, we have a medical system that is what I call the disease model. And the disease model means that something's got to be broken, before we do something about it. Your hormones may not technically, like in a man, may not technically be below the level where we call it a disease. Hypogonadism is the term used with men when testosterone is below, quote, the normal reference range. But optimizing means that your levels are not super physiologic or, like you're a bodybuilder, but they're increased so that maybe you're at the age of a 40-year-old. So you're feeling more like you used to feel. That's hormone optimization, which, like I said, I think is a better term than hormone replacement.
So it not only does something for your body, but it does something for how you feel every day. And that's why I wanted to bring it up in a travel show, because
Yeah,
so much of this has to do with the fact of actually feeling old.
yeah,
And we all
absolutely.
have some of that.
Mm,
And we have some of that starting at 40. You don't have to be
sure.
78 years
No,
old to feel that way.
no.
Now, what's the process, though? There's two parts of this process. One would be to get the indicator, to know your hormone levels, and the other
Yes,
would be to do something about it. So let's start with the
right.
first one. Since it's not covered, how do
Yes.
you know what your level
Yeah.
is?
Well, I think first and foremost is talking to a doctor or a medical provider that is educated in hormone optimization, menopause, well, we call andropause in men. It's a little term that kind of plays on menopause and andro and men. So andropause and menopause. So you've got to be open to the fact as a provider that when somebody says they're fatigued, they don't have the vitality they used to have, that you don't just say, you know what, that's normal aging.
Right,
Your
it's not.
labs are, quote, normal. You're fine. Just deal with it. Well, that's unacceptable in my playbook. And the second thing is, yes, getting labs, but ordering the right labs. If you don't check your sex hormones, thyroid, a lot of these hormones that help with metabolism and energy and mood, hormones have receptor sites, which are where the hormones bind in the brain, in the testes, in the ovaries, in the vagina. They bind all over the place. So they do a lot for our overall sense of well-being.
Now, once you know that and you say, well, you know what, I would like to spruce it up. What is the procedure for doing something about it?
Right. Well, I start with a very thorough, good history because I want to know not only what symptoms you're having, but what are your goals? Like you mentioned, do you want to travel or do you want your husband to want to travel?
Right.
What is it that you're wanting? And then I look at the labs thoroughly, including the sex hormones, mainly estrogen, progesterone, and testosterone. And then we come up with a plan. And the plan is maybe you go on testosterone, maybe a woman needs progesterone or estrogen, depending upon her age and what's going on with her. Vaginal estrogen, which of course is for women, is a very big deal because it decreases vaginal dryness, it decreases pain with intercourse. It can change the sexual relationship between two partners, and really change the vitality of the relationship.
Now, for men, would it be testosterone that you would be?
Primarily, yes, primarily. But like I said, thyroid is a hormone. It's not a sex hormone. And it can go down a little bit as we age. And that provides energy, metabolism, mood. It can do a lot of things. So there's a lot going on.
So now, before we take a little bit of a break and come back, administration. You talked about gels. What
Yeah.
else? How else are hormones administered?
Yeah. Primarily, it's gel or cream as well as an injection. And an injection can be very good and efficient because it's a shot once a week and you're getting it in your system. So I actually have a lot of patients, both men and women, that do a testosterone shot once a week.
And is it like Ozempics today? Everybody's walking around with their
Yeah,
Ozempic needles
very similar.
and they're shooting themselves in the thigh.
Yeah, it's very easy. You grab your love handle and you poke it with a small little needle, and boom, you're done.
So very good. When we return, I do want to talk about what's contraindicated, when you shouldn't do something like this. And we have a lot more to discuss. So don't you guys go anywhere because this is unique information. Certainly not information you'll find in every travel show. But I've been tired of hearing that I'm too tired to travel. And when we looked at the folks that are saying this, they are perfectly healthy people. And it's pretty clear that there's a little imbalance there somewhere. We've been talking about different types of imbalances like electrolytes in the past. We've covered that. We've covered what you can do if you have some pain and mobility in walking. Actually, the travel industry is doing a lot for giving multi-mobility trips, but they can't replace your hormones. So I thought, well, maybe you want to do it on your own. Don't you guys go anywhere. We'll be right back. If you've been thinking about a cruise, I've definitely got you covered with Cruises It. Now, we have just become affiliated with them. And who are they? Well, Cruises It is the top agency for all the main cruise lines and some of the less known cruise lines as well. Cruises It has access to booking space that's been open years in advance, so you can get the best cabins, and that's just number one. But they also make the prices lower. The cruise lines give Cruises It their own exclusive agency discounts. And if you're not from the cruise line, they have their own agency discounts that would apply as well. So you get both any discounts you would normally get on the cruise line, plus additional discounts that are given exclusively to Cruises It because they bring in so much business. On top of all those discount perks, when you book with them, you get the best rate guaranteed. And this is because Cruise Fair Watch system takes place. Now, what Cruises It does is it tracks the pricing until the final payment date. So you keep in mind that to get the best rate guaranteed, you have to use my site. We have affiliated with them specifically. I sat down, I met with them in Tucson, Arizona. I met with Marianne Weather. We've now become good friends. She gave me a direct line. Not only a link, which you can certainly use right away, but if you have questions, even a specific phone number. Cruises It offers this not just to anyone that is one of our followers, but if you have friends and family, you can bring them in too. So just take a look at the show notes and you will see our dedicated phone line and our dedicated link. Happy sailing. And now we are back, and we have an unusual show today. We're here with Dr. Jeanette Gray, and she's an expert in what she calls hormone optimization. If you've been reading about it, you may just see it as HRT. They sometimes call it hormone replacement therapy. And you might even not know what those letters stand for until this minute. But I wanted you to know because we have gotten too many people, particularly people who are in their 70s and 80s, who are saying that, gee, all of a sudden, I felt like I was 40, and this, you know what? I'm feeling old. And there is no one, particularly a family physician, that is going to talk to you about hormone replacement, or very few, when you're postmenopausal or if you're out of your 40s or 50s. And many of you are, as I am, and we feel and want to be as vital as we can be. And this is one of those therapies or ways of doing it. So we talked about what hormones are, Dr. Gray, and how they are treated and the administration. When you're older, the first thing you think about is it going to be contraindicated to medicines that I take? Or is it bad for my bones? And the things that we do think about, even if we're healthy people. Right. So who shouldn't do this?
Yeah. Well, to that point in general, I love it when I can see a patient in their 40s before they start having the diseases that can occur due to hormone deficiency. You know, for instance, women get osteoporosis. If the woman isn't offered hormone replacement therapy and then they don't do a bone density until she's 65, she's developing osteoporosis, which is a horrible disease. I mean, 50% of women after 50 develop a osteoporotic fracture of the hip. in their lifetime. And of those women, 25% actually die from an osteoporotic fracture. And the reason I go into it a little bit is the fact that that's preventable. And so I love it when I could see somebody at an earlier age, 40, 50, check their hormones, get them on the right hormones to prevent these diseases that will debilitate them. So let's prevent it. And so in terms of, reasons why you shouldn't take them, there aren't a lot. There was a study 24 years ago that made hormones look bad and everybody reacted to it. Well, that's been debunked. It was called the Women's Health Initiative, and that was estrogen and progesterone, not testosterone, but estrogen and progesterone. And it showed when it was reevaluated that in fact it protects women from osteoporosis, breast cancer, metabolic diseases, cancer. So it's a very important hormone. And then testosterone used to be thought, oh, you can't take it. It increases heart disease in men. Well, that's been debunked just recently in a recent study. So there really are very few. Even breast cancer is questionable whether it is an absolute contraindication to estrogen. And testosterone is really not a contraindication to prostate cancer anymore. But of course, we're going to be cautious and we're going to make sure we get a good history.
So I'm very angry about that old study that you're talking about.
Yes. Oh, I know.
I have to tell you that when I was 50, I started menopause, and it was the best time of my life. I'm not kidding. My skin was gorgeous. I lost weight. I was running around. Everybody was, sweating. Not me. It was great. Why? I had the estrogen. But the study came out.
Yes, I know.
It was about 4 or 5 years I was already taking it, and I stuck dead.
No, our generation, especially the baby boomers, got really messed up with this study.
Messed up. And the moment I did it, I gained 10 pounds. My skin started to dry out, and it's never ended.
As soon as you want to start aging faster, stop your hormones, is what I say.
That's exactly what happened, which is not a travel-related issue, but the fact is it's a truth. All right, so I'm very angry about that study. Now, today, healthy older adults generally are taking a statin because that's always given to them. And they may be taking a blood thinner, or they may be taking just a Tylenol, even that sort of thing. That's about it. Are there any traditional things that older adults take in medicine that might be contraindicated?
The hormones really have no contraindications to any of those kind of medicines. But as an internal medicine doctor, specializing in hormones, I always look at the whole. That's why history is so important. I want to know what's going on with all of you, because I'm looking at longevity, and all of those things play a role in your health, well-being, and longevity.
So now I want to ask you a question that is directly related to travel, because you actually brought it up, and that is osteoporosis. When you travel these days, everybody's really looking for physical activity as well.
Yes.
Not only seeing another cathedral or having lunch in Paris, these are all wonderful things. But the idea of active travel has really caught on. So we have our hiking vacations and our long distance walking and our bicycle vacations, and everything has to do with the possibility of falling.
Yes.
Now, and I can tell you this from the travel industry, when there are excursions, older adults are constantly told not to go by concierges in hotels, by shore excursions on cruises. Why? They're so afraid we're going to fall.
Yes.
And if we fall, we're going to break our hip. That is exactly what the problem is.
Yeah, I get it.
So you talked about osteoporosis, and we do get, it is included in Medicare if you're over the age of 65, a bone density test.
It should be done at 50, not wait until you're 65. And now you go, oh, I guess I have osteoporosis. I need a medication. Do it at 50 so that you can check your vitamin D levels and maximize those. Then that's easy to take vitamin D. You can do weight-bearing exercise, and you can potentially, hopefully, be on hormones, especially estrogen, and you can prevent it in the first place.
And when you do get that diagnosis, and even if you don't have osteoporosis, you'll probably get the diagnosis, and those of you who are listening can nod your head if you have one, the diagnosis of osteopenia, meaning you
Yes.
are in danger of
Right.
osteopenia.
Pre-osteoporosis.
And I doubt that many people over the age of 65, particularly women, don't have that diagnosis. I do, and for a long time,
Very common.
and very common. And what they say to you is, you'll break something if you fall. And the minute you hear that, it does stop certain kinds
Yeah.
of travel.
Sure.
Get nervous
Yep.
about the
Yep.
hike or the walk or whatever it is that you're worried
Mm,
about. And this is a common travel issue.
yep. Yes.
So are you thinking that hormone optimization, I'm going to use your term from now on, for older adults postmenopausal who maybe didn't do in their 50s what you suggest they do, that can still help in bone density or yeah, you think so? All right, let's hear about it.
Well, actually, there are studies that show that women with osteoporosis who went on estrogen and their max and optimize their vitamin D and do strength training or weight bearing exercises can increase their bone density by doing that. So it is shown that you can reverse it to some extent. And if you are already, like I had a patient recently that's 70 years old and she plays pickleball and she wants to be vibrant and keep playing for the next 2 decades, if possible, or longer. And, her testosterone levels were low. I had her, I said, you know what, you need to go get a DEXA scan. You need to know what you're dealing with. And she had severe osteoporosis. And so now she's like, oh, should I be careful? What should I do? I said, do the testosterone, get your vitamin D levels, continue to do weight bearing, but be cautious. Don't be foolhardy. Don't go jumping out of a plane or riding a horse. And then get on a medication because there are some really good medications like Prolia and Forteo that do work to reverse osteoporosis. Be as proactive as you can be so that you don't have to stop doing the things you love.
Yeah. So, last week or a couple of weeks ago, our show was Anyone Could Be an Adventurer.
Mhm.
And the idea of jumping out of a plane, the idea of horse riding, and many, many other
Right.
things are now actually being assisted
Yeah.
so that older adults can do all of those
Yes.
things. But you
Mhm.
have to feel vital enough
Yes,
to
you
want
do.
to take these challenges on. And then when
Right.
you do, you learn that you can do it and it builds self-confidence.
Right.
From that, you're less helpless for the rest of your life.
Yeah, absolutely.
So all these things have this wonderful domino effect
Mhm.
with regard to it. Now, of course, your passion, it comes through as we're talking, and you channel that passion into a book. It's an
Yes.
interesting title too, The Truth About Sex Hormones. But of course, we're
Hmm.
not talking only about sexuality and hormones. In fact, in this
No.
show, we're talking very little about that. We're talking
Hmm.
about life vitality. But
Yes.
in that book, why do people have to know the truth? What do we not know?
The truth is that hormones can not only give you vitality and a sense of purpose and wellness, but they also can prevent significant numbers of diseases that we all die from, like heart disease, osteoporosis, cancer, metabolic disorders, and even Alzheimer's. So it's very important.
And tell us a little bit about the book, because as I said, in our age group, we have very little information about that.
Mhm.
Younger folks in the menopausal part of their life do have a lot of
Yeah.
information these
More
days,
now. Hmm.
and they even talk to each other about it. But there is a Menopause the musical, but
Hmm.
there's no Postmenopause the musical.
Right.
So,
Right.
so tell us a little bit about what we find in the book that'll help us out.
Well, I wrote a simple book. There's books on menopause and hormones that are very thick with scientific data. And although this is backed by science and many studies, I really wanted to get across the idea that you're never too old to consider hormones, that one size doesn't fit all, that you have to question your doctors and ask for what you want. And then I have some vignettes in there. In fact, I have one of a lady that's in her early 70s that was a widow for 10 years that met a guy and wanted to go on a cruise. I got her on vaginal estrogen and testosterone, and in 3 weeks, she was ready for that cruise and she had a great time.
Well, that sounds very good. Very interesting kind of
You know,
cruise.
they're
See,
true stories. They're
I
true
always talk about
vignettes.
the food and what the size of the cabin, but
Yeah.
maybe I should be thinking about
Yeah.
doing
Maybe you
that.
could talk about the size of something else.
That's
I don't
right.
know.
That's exactly my point. So this is fascinating. Now we're going to take a little bit of a break. When we come back, I do want to talk about cost. Is there any type of condition where hormone replacement might be covered? And otherwise, what can we expect? And don't you guys go anywhere because this is a show that really tells the truth about things that can make a difference in your life so that you never stop traveling. Don't go anywhere. Did you know that 3,000 people receive the Ageless Traveler newsletter every single Tuesday and it's free of charge? Well, you simply subscribe on our website, agelesstraveler.com, when you see the pop up, or take a look at the resource section that's in the show notes accompanying this episode. You'll also see how directly you can subscribe to our newsletter. Now, what will you find in there? Well, every single week, you will get news you can use about travel, cultural experiences you can enjoy, suggestions for luxury travel for less, and yes, I answer your questions. And you can even send me those questions by text or voicemail, and you'll see just how to do it when you receive your Travel Tuesday newsletter. Plenty of discounts, plenty of inspiration, so that you never stop traveling. That's agelesstraveler.com. Take a look at the pop-up, subscribe, or take a look at our resource list accompanying this and every episode so that you get a direct link to Travel Tuesday. And we're back, and we're here with an expert on hormone optimization, also vitality, longevity, what it can mean to you in your everyday life, and certainly for this show's purposes, what it can mean in your travels. Her name is Dr. Jeanette Gray. You'll find out how to find her in our show notes as usual, because she's very generous with her time, and she's very committed to helping people of all ages, really, lead their best life. So when we left, right before our break, we were discussing the fact that there's cost involved because, as you have said, Dr. Gray, we're in a cure model or a disease model. If you've got something wrong with you, our system goes all out. It's really one of the best places to be sick is America.
Yeah.
It's not a great place for prevention and not getting sick because we don't have a lot of money that we put into prevention. But there is one thing that has been suggested that is covered, particularly for older adults, for the problem that you discussed, which is osteopenia or osteoporosis, and the fear that if you fall, you'll break something. And it's a shot, and it's called Reclast. It may even have other names by now if there's some competition. But that's one of the rare things that I know is covered for somebody who is not diagnosed even with osteoporosis, but at least has osteopenia. What is it, and does it have anything to do with hormone replacement?
It is a medication it's a class called bisphosphonates that helps slow down the breakdown of bone so that the building of bone can be faster than the breakdown because bone is always remodeling, which that's how it grows. It breaks down and it grows. But unfortunately, when estrogen goes down in particular, as well as testosterone, but mostly estrogen, the body starts breaking it down faster than it rebuilds it, and it accelerates after menopause. And so there are many medications. One is Reclast, which is a bisphosphonate, but it's an IV, so you don't have to take a pill every day. But there are other medications like Prolia and Forteo that actually may build even better bone than the Reclast, but it is one of the medications that are offered once you already have the disease of osteoporosis.
Now, so if you have such a shot, can you also have hormone optimization?
Absolutely. You can do it in conjunction. So you're just like I mentioned, optimizing your vitamin D levels and your weight bearing exercises. Do it all to just hit it from all angles.
You know, people probably know the name Dr. Oz. He had a partner many years ago who I met, and together they wrote a book called Real Age.
Mhm,
Right
I
now,
remember.
by now it's quite an old book, and you
Yes.
were able to take an analysis of yourself. And it was kind of a pioneer. in the
Yeah.
idea that your age is not your chronology. It's not the day.
Right. Biological age versus chronological.
Exactly. And the
Hmm.
partner said, if you want to keep your bones good, stand on your toes and then
Down.
really slap your feet down.
Yeah.
Do it
Yeah.
50 times a day. That's
Right.
the kind of thing that you're talking about. Of course, we're much more sophisticated
Yeah.
today.
Or go on a step that's a 6 or 8 inch riser and jump down 20 times a day. Something like that is enough to stimulate your bone.
Yeah, so fascinating. So
Yeah.
now we're getting to the topic that, that doesn't get aired very much, and that is cost. When
Yes.
we have something covered, terrific. Whether it's by private insurance or our employer or a
Right.
government program, no, not an issue. But lately, some very important things have been questioned, like dentistry isn't covered,
Right.
hearing aids, a lot of
Yeah.
things that really
Yeah.
make life worth living.
Huge. Huge. Yeah.
And this is one of them. That's
Yeah.
why medical tourism was born, because you can have
Right.
the same procedures in different parts of the world for a fraction of the cost as it is in.
Right. Right. Well, the first thing is we're back to the disease model. Unfortunately, we're still in America anyway, stuck with the fact that if it's not a diagnosis that has an ICD code that you can attach to it for billing purposes, it's not covered. So even for men with hypogonadism or andropause, if it's not below a very low number, it's like 250, their total testosterone has to be before it's considered hypogonadism and therefore covered benefit. So there we're not in the optimal aging range, we're in the disease range model. With women, estrogen and progesterone for menopause is covered most of the time. Testosterone rarely covered because there's no FDA approved testosterone medication actually, even though there's over 30 for men. So that could go off on, the fact that women's medicine and women's sexual medicine is very much ignored versus men's in general. But saying that, what I do is I try to make it as affordable as possible. I don't take insurance for that very reason because it's not going
There
to
is no
cover it
insurance.
anyway. So what's the point? So what I do is a membership, and for instance, to be on testosterone would be about $179 a month, but that includes everything, your medication, your hormone, your labs that I check every 3 months to 6 months, depending upon what we're covering and following, as well as all the consultations you might need. If you need to talk to me every week, I'm here. If you need it every month, perfect. And I check in with you. I make sure that everything else is balanced. I look at your cholesterol, your diabetic markers, your thyroid. I really look at your longevity as a whole.
So that's about the
Yes.
cost of your monthly facial. I know
Yep.
it's important to know because this is a show about reality.
Yes.
And we do talk a lot about medical tourism. We've covered medical tourism.
Hmm.
It's growing. We just heard yesterday in the travel industry that Vietnam has decided to make itself the number one wellness and medical tourism venue
Yeah.
to
Oh,
have
absolutely.
for
And they
all.
travel to other countries and get medical procedures done. Like
Yeah.
I'm in San Diego by Mexico. People go there all the time to get their dentistry, their eyes checked, plastic surgery, all of that.
And in fact, you hit a nice note because my dentist is in Tijuana.
Uh-huh. Great.
And we actually
Yeah.
had an article in Fromers Travel
Yeah.
on
Wow.
how to go to Tijuana for your
Hmm.
dentistry and what
Right.
to see as a tourist while you're there.
Right.
So,
Great.
but
Right.
here, from what you're telling me, in general, the practice of hormone replacement wouldn't really require you to get on a plane. You can find a good practitioner and
Yes.
maybe take a facial every other month instead of every month.
You have to look at your budget and that's why, when I talk with patients, those are the questions that come up. What do you value? What is it you want to do? And how do you budget something that you value? And, you can't put a dollar sign on your health, but you have to.
And of course, you can't put a dollar sign on your feeling about yourself and your own
No,
vitality. Now, we're going to take our
exactly.
last break. And when we come back, I'm going to ask you a question that we talk about, but don't have an answer to. And that is, how do you know with these kinds of therapies when you're not ill that there's been a change. And I'll give you an example. A lot of people spend a lot more than you just mentioned just on nutraceuticals.
Yes.
They may take 4 or 5 different kinds of nutraceuticals a month, let's say,
Yep.
each being $50 a month.
Hmm.
It's a big budget item. And we ask each other, how do you feel? Did it do you any good? And the answer is, I don't know.
Right.
I don't know if it does. I'm just afraid to
Yeah.
stop taking it because
Right.
maybe if I stop taking it, it'll be bad. But
Yeah.
most of the time, we can't tell you
No.
because it's not like the flu. We know
Right.
we've had the flu. We know we're over the flu. But
Right.
this is something different. So I'm going
Yeah.
to ask when we come back, how would we know if this is doing something good for us? Or is it just through taking more labs and seeing the levels? So don't you
Right.
guys go anywhere. We'll be right back. You may have been reading in our Travel Tuesday newsletters that travel increases your longevity. Over and over again, the research shows why. You make more connections, you thwart loneliness, and you simply have a great time. So why not get started now from your armchair? Simply go to agelesstraveler.com and see our invitation that asks you right on the homepage to join our Facebook salon. We call it a salon, not a group, because it's a place to meet people, to connect, to travel together, to share your travel experiences. So simply go to agelesstraveler.com and join our Facebook salon. And now we're back with Dr. Jeanette Gray. But when you take hormone replacement, do you feel different? Because that's what we've been talking about.
Right.
How you feel every day when you wake up.
Right.
How do we know that it's working?
Well, all this information about prevention of heart disease, breast cancer, osteoporosis, diabetes, Alzheimer's, it's all science backed. There's many, many studies now verifying that that is true. And at the same time, most of us, a lot of us, are very results oriented. Do I feel a difference? And, when a woman's perimenopausal and menopausal, she may or may not go through changes that are uncomfortable, right? Like hot flashes and night sweats and irritability and not sleeping and weight gain. I mean, there are hundreds of symptoms that a woman can have during perimenopause and menopause. So, saying that, if a woman does not experience those symptoms, I still explain to her that you're going to get the benefits of reducing heart disease by almost 50%, osteoporosis significantly. So, then you've got to be a believer in the science.
Mm-hmm.
And so sometimes people come into me that are older, maybe they're in their 70s and they don't have the vitality that they have. I do an in-body scan and I see that they've lost a lot of muscle mass, which of course is correlated with lifespan, longevity,
Sarcopenia.
vitality.
Yeah,
Right.
sarcopenia is the name.
So, yeah, exactly. So I will say maybe they have symptoms like brain fog and low energy. So they may feel better, which is great when somebody goes, "Oh my God, I can't believe, how I was feeling." That men especially, it happens more gradually than it does with women. And they'll just get to a point where they've gained 30, 40 pounds. They're fatigued. They don't want to travel. They're just not themselves. Or maybe they have low libido and you don't even want to have sex anymore. But it happens so gradually, they accept it as normal.
Right.
And in those people, oftentimes they do feel a significant difference, but not always. It depends on where you're starting from and where you want to end up.
Yeah. So we'll end with a big issue only because you brought it up, and that is sarcopenia. Sarcopenia,
Mhm.
if you're looking in the mirror, it's saggy skin, very, very dry skin. Frankly, it makes you feel old. And
And
it's all over the body,
muscle
and
loss.
muscle loss and muscle wasting.
Yes.
And it's not just cosmetic. It really ends up being a disease.
Yes.
And so far, everybody's running around in the field of geroscience trying to figure out what to do about sarcopenia. Of course, everybody tells you to exercise and, eat protein and all that sort of thing. But there hasn't been any magic bullet as yet with regard to it. So what is the connection there and hormone optimization?
Well, we know that after menopause, around 51 being the average age, that a woman will lose about 5% of her muscle mass per decade. And men lose a significant amount as well. But again, it's more gradual because they don't have that falling off the cliff hormone loss like women do.
Right.
So it's going to happen naturally, gradually, if you don't intervene. And that's where, like I was mentioning with the bones, you want to hit it from all angles. So yes, enough protein, 1 gram of protein per day per pound of ideal body weight is really the recommendations to maintain muscle mass, and not lose it. Weight bearing exercises, strength training in particular, very important. And then hormones. And you can do some supplements like creatine has a good amount of data showing that it will help you build muscle as well. So I like to hit things from all angles and get the synergism that you get from doing all those things.
So I'm very, very happy that we did cover this. And, everybody should know that we've got a free newsletter called Travel Tuesday. You can go on agelesstraveler.com and you'll be able to subscribe to it. You'll get it every single week. We also have some wonderful free ebooks for everybody that supports some of the issues that you tell me about. And we have Ask Adrian. And one of the things you have asked me is, what can I do about my lack of vitality? I used to be such a heavy traveler. In unpacking the lack of desire to travel, we find there's a lack of desire for many things. It's not just travel. It's all one piece. And one of those things is this issue of vitality, which led me to speak to you, Dr. Gray. So if you could give at the end of our show one piece of advice
Yeah.
that you think would really make a difference in our futures with regard to this topic, what would
Yeah.
it be?
It would be that you're never too old to evaluate your longevity, your vitality, and consider hormones if that is, appropriate for you. Connect with a medical provider that specializes in hormone replacement therapy or hormone optimization, and then get your labs ordered and have a discussion. What are your goals? What are your desires? What would you like to see different in your future? And that's the end goal.
Wonderful. I thank you so much. And for everybody else, please join our Facebook salon. As you know, that's always free. You go to agelesstraveler.com, or you can take a look at our show notes. You'll find how to connect with Dr. Gray. You'll find how to subscribe to our newsletters and be part of our community of ageless travelers. And you know what I'm going to say? Never stop traveling.